Hi everyone, Trevor Petrie here, certified hand therapist, and today I'm going to be talking about what to expect after some of the more common hand surgeries that people might go through. The ones I see the most often and that the surgeons at the practice I am at probably perform the most are carpal tunnel releases, trigger finger releases, and then one that maybe most people don't know about, but I see a ton of, are Cmc thumb arthroplasties. So when they take the base of the thumb down there and they pull a bone out and they recreate the joint in response to arthritis pain. So the main thing to know about any surgery from any surgeon, no matter how good, or maybe even if you've seen them for other surgeries, there's no such thing as a 100% guaranteed surgery. Even a really, really good surgeon cannot guarantee you with 100% assurity that their surgery will do everything that you hope it will do. Carpal tunnel releases and trigger finger releases actually have very good outcomes. I think the most thorough study I've read on carpal tunnel releases show that there is anywhere from about an 80 to an 85% satisfaction rate long term with carpal tunnel releases. And I believe trigger fingers are right up there at around the same rate. Maybe even closer to 90%. Now, one thing to point out, and I always point this out to my patients too, is that a satisfaction is not the same as perfection, right? So people that are satisfied and have improvement in their symptoms don't necessarily get a 100% improvement that gives them the hand that they had when they were, 10, 15, 20 years younger. With carpal tunnel surgeries, for instance, there may be lingering paresthesias in the fingers. There may be something called pillar pain, which is when you sort of get a pain that goes up the middle of the hand. It kind of runs up and down the middle of the hand, and that's from those little bones. When you cut the ligament for the carpal tunnel, they shift a little bit, and that can create some pretty good lingering aching pain, and that's totally normal. Incisional pain is very normal after almost any surgery, and that can take several weeks to go away. I will tell you that one of my more common experiences as a therapist is that surgeons tend to take a bit of a rosy vision of what a recovery from everyday surgeries for them, surgeries that they perform on a daily basis. And so they'll tell you things like, well, it'll be sore for maybe a week or two, and then you can pretty much do everything you need to do. And I will tell you that, yes, that does happen occasionally, but the large majority of people, there are definitely healing rates that occur, and a surgery, no matter how minor it might seem, is still an injury, and there's certain physiological processes that have to take place that take time. So important things to remember after a surgery, any surgery whatsoever, is find out how much you can move, how much is safe to move. Move as much as you can within that parameter, right? You don't want to stay absolutely still unless it's surgery for a real bad injury like a fracture or a tendon laceration that your surgeon has specifically told you cannot move. But for things for carpal tunnel, tendon, for trigger finger releases, even for Cmc Arthroplasties, you want to move everything they let you. People will wind up with things like tennis elbow and frozen shoulder because they've had carpal tunnel or trigger finger releases, even something relatively minor. But if they've never had a surgery before, maybe they don't know how much is the right amount to move, and so they don't move at all. Or conversely, they move too much and they don't let their tissue heal. Right? Your body needs time to recover. Sometimes The appropriate amount of stress to help with healing is no stress. Every once in a while, you just need to give it a break. Um, so I would say for a carpal tunnel surgery and a trigger finger release, you can expect, 2 to 4 weeks out even, things might still be a little sore. They might be a little achy. Pushing out of bed might still be a little painful. If you waited a long, long time to have a carpal tunnel release, you might have some tingling and numbness in the fingertips still. Hopefully it will improve. But there might be a certain amount of that will never come back to be 100%. So these are all things you need to be aware of. When you have a surgery, it doesn't mean that you are then fixed and that everything will be fine as soon as you wake up and get the bandages off. There's some recovery to be had even with minor surgeries. But that should not be a reason to be avoidant of a surgery that might be necessary. You don't want to wait forever to have a carpal tunnel surgery if it's gotten to the point where those fingers are totally numb or you're starting to get a little muscle wasting. You gotta have something done to fix that if you ever want that nerve to come back. And again, 85% satisfaction rate. That's a pretty good return, I think, on a surgery, even if it means it's not perfect. Cmc Arthroplasties are one that I see a lot of because basal thumb arthritis is so prevalent. And I think that recovery times for something like that take people by surprise almost more than any other surgery. Most surgeons, after that particular surgery, it's again when you replace the joint at the base of your thumb, most surgeons will want you to be immobilized for 4 to 6 weeks, either in a cast or a thermoplastic splint. And then when you do get moving, it's real slow. I worked with a surgeon once that used to tell his patients, at 3 months, you'll wonder why the heck you did it, and at 6 months, you'll be glad you did. And I find that for a major surgery, where you do any kind of joint replacement, or any kind of work on a tendon repair or tendon graft, anything like that, or a fusion of a joint, especially like a major joint like a carpal bone, anything like that, or wrist, you can expect that to be pretty much to be expected. About 10 to 12 weeks or so, things might actually become more frustrating because things are starting to feel better generally. But then you try to do something because it feels pretty good when you're not using it, and then it tweaks, it's painful, it reminds you it's not better yet, it's frustrating, and then you feel like you've set yourself back. And basically what that process is that about if you look at healing, at 6 to 8 weeks, your body is dumping a ton of scar tissue in the area when it's healing from an injury or surgery. At about 10 weeks or so, everything is starting to really mature and tighten up, but you still need to stress that tissue as it realigns to resist those forces you want to put on it. So at 10 to 12 weeks, for a lot of surgeries, all of a sudden things might feel like they're tweaking a little bit more often, and that's because that scar tissue has become matured and it's sort of contracted and it's shrunk down. And so it takes a little bit more, and it might be a little bit more uncomfortable to try to get that sorted out. So just remember, as a takeaway from this talk, that there's no such thing as a guaranteed outcome for any surgery whatsoever. Make sure that you discuss with your surgeons all the possible outcomes and what might happen, within reason, of course, and be aware of what the risks are and what the recovery is really like. And don't be afraid to ask for help if you want to go see a therapist or anything for any surgery afterwards. You want to make sure you take care of yourself. And the other thing is remember that you might have little things, little aches and pains, for much longer than you expect. That 6 to 8 week marks, you might feel a lot more stiffness all of a sudden. And that 10 to 12 week mark, all of a sudden you might find that you get little tweaks and twinges and things where you weren't expecting it. But don't let that discourage you. Make sure you keep communicating with your surgeon, and keep moving everything that you can. Even if it's not directly over the surgical site, even all the soft tissue structures around it, keep moving. Everything, your body likes to be used, it likes to move, it likes to be stressed, and so that way it can heal better and appropriately so that you have a better outcome later on. Hopefully that gives you some idea of what to expect after most hand surgeries. If you have any questions, please leave them in the comments. Like usual, I'll be kind of lurking around the Grace Enable page as well as the Hand Pain Facebook page to answer any questions people might have. And keep moving, stay healthy, and take care of yourself. All right, thank you very much.